Wellness for Life is brought to you by Back in Motion Physical Therapy.
Hello, I'm Matthew Koffenberg, physical therapist and owner of Back in Motion Physical Therapy in Perham, Minnesota, as well as Park Rapids, Minnesota. Today I thought I'd talk about something a little different, a little out of the ordinary. It's a quite rare condition that I'm going to talk about today. It does not affect many people. I've been practicing as a physical therapist for about 20 years, and I've seen a handful of these. But when they come into your office, you know it right away. People are in quite a bit of pain, and actually it's pretty easy to deal with. So what we're talking about today is called Thoracic Outlet Syndrome. Thoracic Outlet Syndrome is characterized by symptoms of, you can have some chest pain, you can have neck pain, you can have arm pain. A lot of times the arm feels really, really heavy, and a lot of times you're going to have temperature changes in the hand itself. It'll feel really, really cold. So there's pain associated with some temperature issues. And the reason for that is actually quite simple. So if we look at the anatomy, I can kind of show you what's happening with thoracic outlet syndrome. So the condition actually happens right here. This is where the problem lies, right where the collarbone and the ribs and the neck kind of meet. That's where the issue is. So that's what this picture is. So we've got the neck here, and then I've got the collarbone, and I'm describing a couple of the ribs, and then the sternum. So the ribs attach into the sternum, and then they wrap around and attach into the spine. So the issue with thoracic outlet is when the tissues between the collarbone and the first rib, so there's several tissues between the collarbone and the first rib, those tissues can sometimes get squished or compressed. So what's in between the collarbone and the rib, it's called the neurovascular bundle, but it's comprised of a big vein, a big artery, and then a nerve. Those three structures make up what's called the neurovascular bundle. They all come from the neck, and then they dive underneath the collarbone and right above the rib. Sometimes those structures can get compressed. So that's why we'll see some temperature changes. That's why we'll see pain, because the nerve is getting compressed, you're going to get pain. The temperature changes are when the vein and the artery get a little bit compressed. So why does it happen? Here are the main causes. You can either have muscle tightness, you can have an elevated rib, you can have an extra rib, you can have some postural issues, or you can have some weakness. So let's kind of go through those one at a time. So muscle tightness. So what does that mean? So there's a large muscle of the neck called the scalene muscle. That scalene muscle comes from the neck bones, and it drops down. It's actually got three portions. It's got like an anterior portion and a posterior portion. That comes from the neck, and it actually comes in through here. I don't know if you can see that, but it actually attaches to the first rib. It doesn't attach to the collarbone. It actually attaches to that first rib. So if that scalene muscle gets short, it'll actually take that rib and lift it up. So if that rib gets lifted up, you can compress those structures. The other muscle that can get tight and create problems with thoracic outlet is actually your big chest muscle. It's called the pectoralis muscle. So that big pectoral muscle starts from the sternum, and it actually comes up. It actually attaches over to the arm here, but it actually blends into the collarbone. That's what this is trying to depict, but it actually attaches into that collarbone. So you've got this muscle that sits here. If that muscle gets tight, it can take that collarbone and actually pull it down. So if you've got the combination of a scalene muscle and a pectoral muscle that are tight, you can really have an issue, because the first rib could be elevated and the collarbone could be pushed down, and then you could really squish those structures that are in between it. So that takes care of the muscle tightness issue. We talked a little bit about the elevated rib. A lot of times it's elevated because the scalene is tight. Other times it's just a functional or an anatomical issue where some people actually just have an elevated rib. Or some people become what are called upper chest breathers. You know, we have this large diaphragm muscle that we're supposed to use when we breathe, but a lot of us end up using our neck muscles and we become upper chest breathers, and that causes, a lot of times that'll cause that first rib to elevate and can compress those structures. Now, another interesting fact is that some people actually have an extra rib. So they'll have, and I didn't draw this, but this is the first rib, this is the second rib. Some people actually have an extra rib that sits right here and it wraps around. Those people, if you've got an extra rib, extremely rare, but if you have an extra rib, you're almost guaranteed to end up with thoracic outlet. Those individuals usually need surgery. A lot of times they'll have to go in and actually take that rib out. It sounds scary, but it's actually a pretty safe and easy surgery to do. Again, it doesn't happen. I've seen it happen once in my 20-year career where someone had to go in for surgery. Posture and weakness often kind of go together. Postural dysfunction, if someone has poor posture, so I'm going to really exaggerate poor posture, but poor posture is usually described by forward shoulder and forward head. Well, this position is going to tighten which muscles? It's going to tighten the pec muscle and it's going to tighten those neck muscles. So if you have poor posture, especially if you work at the computer, over time you could develop significant tightness and cause compression of that neurovascular bundle. So really just watch your posture. And along with posture, we tend to end up with weakness in the back. So we tend to end up with weakness in what's called the lower trapezius muscle. So when we're forward like this lower trapezius muscle often gets stretched too much, and a stretched muscle becomes very, very weak. So we often want to develop a strengthening program to really get this the shoulder blade muscle strong, and you can hold yourself in better posture. So if you suspect you have thoracic outlet, come and see me, come and see a local physical therapist. This is actually really quite easy to deal with. You stretch some muscles, you build some strength, you work on posture, and a lot of times you can take that pressure off of that neurovascular bundle. Thanks for listening. If you have any questions, give me a call at 218-346-2464.
Thank you for watching Wellness for Life.